Hi, it's Dr. William. Let's talk about Mons liposuction versus inner thigh liposuction. These are two areas that come up quite often. So typically, when I do liposuction, what I do is I do what we call lipo 360, or also known as lipo 12. These are just 12 areas. And what that is that's full liposuction all the way from the breast all the way down to the waist, and then in a 360 degree where we're going all around the body, high in the back, all the way down. That's lipo 360. We can also perform liposuction in this area. Some people call it the fupa. This area, technically we call it the Mons, short for the Mons pubis, is a pubic bone here. Or we can do liposuction as well in the inner thigh. But these two areas are really quite different. I just want to sort of talk about that today and sort of get through the differences between these two things. So in Mons lipo, I would say that most people by and large can have liposuction in the Mons area. The reason that we do that, or I mean, occasionally I'll suggest that. I don't like to necessarily suggest things to people, but what I'll do is, if I think that somebody really has quite a bit of fat in that Mons area, and that's not part of the lipo 360, then I know people are worried after surgery that their abdomen will be flat and then they could have a little bulge in this Mons area. So when they look down at their tummy, they see a nice flat line, but then they see a little bulge. Or particularly when patients are wearing tight-fitting clothing or dresses, they can notice a little bulge here. So if I think it's going to be a problem, I'll try to point it out, or other times I'll just rely on people to ask me if it's an area that, maybe currently bothers them. So the Mons area is very easy to lipo. The fat comes out readily. It does swell a lot, so it's not uncommon that if you've had Mons lipo to have some labial swelling after surgery as well. That usually goes down. It's not too often. I honestly can't really remember the last time I did this, but it's not very often that even if you have some ptosis, if you even have a little droop or laxity of the skin there in the Mons area, it's not very often that we'll do liposuction and then we have a lot of looseness there. If you do, it's okay. I mean, we prefer if you don't have the looseness, but if we do lipo first of the Mons area, and then we're left with some laxity here, then we can do what's called a Mons plasty, and that's whereby we actually will remove part of the Mons, we'll cut part of the Mons, we'll get rid of that skin, and then we'll usually pull it up in this kind of direction here, and that'll tighten it. So Mons lipo is a really good it's a really good option. It's something that's worthwhile considering if you have a little bit of fullness there already, or if we can anticipate that after lipo 360 it may be a problem. Now I will just say this, and there is supposed to be fat in the Mons area. It covers the pubic bone and it's required for comfortable intercourse. If you're too aggressive in liposuction there, or I've even seen online people removing a fat pad from there during a tummy tuck. If you do that and you thin the Mons out too much, you can then develop painful intercourse there because your pubic bone is not really protected. That fat that's there is providing some protection. So I do have people ask me, oh, can you lipo my Mons? And sometimes I'll say no, because you don't really truly have any excess fat there, and lipoing in the Mons could create a problem. Now let's talk about the inner thigh. So just an area adjacent to it here is the inner thigh. This area here is a little bit more tricky, and you have to be aware. So I would say this is probably 90% of the time that patients ask me for inner thigh lipo, I'll actually say no. And I'm not trying to be mean, but I've done lipo on the inner thighs many, many times, and I've been in practice a long period of time. And so there's been times early on in my practice where I've regretted doing the lipo in the inner thighs. And so what I've come to realize is, yes, it's a good procedure. Yes, there are good candidates. Are most people good candidates? No. I'll tell you who is a good candidate. So it normally does go in at that area, but then it also typically comes out, goes in, and comes out again when you get to the knee. So this is what we call a normal shape. And what I've learned a long time ago, that if you like, because liposuction removes fat, right? So, oh, I've got fat on my inner thighs. I want to have a thigh gap. I want to have better spacing. They're chafing, they're rubbing. I don't like they're uncomfortable in pants, whatever the reason. So it's like, oh, you have fat there. We'll just remove it. I mean, that intuitively makes a lot of sense. But the trouble is, if you start to lipo patients with normal shapes, you're going to create an abnormal shape. And it's really easy to do in the inner thigh. And what complicates it and makes it a bigger problem is somebody can always move their thigh into a position where it can become a problem. So it may be that the patient looks okay standing straight ahead and their thighs look fine after you've done liposuction. And we're talking a normal shape. Okay, we've maintained the shape a little bit. We're just taking a little bit of fat. They're thinner. But when patients will then externally rotate their hip or lift their thigh or move their leg, they can show you and say, hey, look at this though. When I do this, now I have this weird contour. And so that's why I don't lipo in an area of normal shape, because I can create an abnormal contour, and that is really tricky. And I've seen so many patients over the years in situations where I haven't done their lipo but come back or come to see me, and they'll say, hey, can you fix my inner thighs? And the answer is no. Most of the time you really can't. So just be careful. Mons, for sure, that's usually not a problem. If you do develop some excess skin, easily correctable with a monsplasty. Inner thigh, if you have a normal shape, stay with the no. The patients that are good candidates for inner thigh lipo are those that this black line here is not normal, or they've got a transition between this part of the thigh and the rest of their thigh, where they really have a discrete area of fat that is not a normal shape. It is not normal. And so then I can lipo that, and after lipo, we can return it to a normal contour. Those people do really well with inner thigh lipo.